All right, our next segment, we're going to talk about interprofessional collaboration in the orthopedic setting. And this is a very important topic for athletic trainers to be thinking about and really looking at, most importantly, I think, reflecting on their own situation. And Chris and Marc are going to have some great takeaways to help you do that, because it's going to help you elevate your practice and your collective culture of your healthcare setting, wherever you're in, to the next level. So Marc and Chris, thank you so much for taking some time. Just some background again. Marc is an athletic trainer with Columbia Orthopedics, and Chris is the division manager of the Department of Orthopedic Surgery for Columbia Orthopedics. They work together as a great team, and their presentation showcased that as well. So I want to start with you, Marc. What are the primary principles of interprofessional collaboration?
Yeah, so thanks for having us here today. So there's four basic principles when we talk about interprofessional collaboration. The first one is, when we work with individuals of other professions, we try to maintain a climate of, let's say, mutual respect and shared values. And that first principle is the values and ethics of this interprofessional practice or collaboration, as we refer to it. The second is, the principle of roles and responsibilities. So we use the knowledge of, each and every healthcare professional's roles and those of, again, the other professions that we work closely with to really, appropriately assess and I guess address the healthcare needs of patients, athletes, and to really promote and advance the healthcare profession and the specific populations that we deal with, whether it's again, high school, college, professional athletes, or even like weekend warriors. And then the third, which we focused on a lot, if you were able to see our presentation, was communication. Communicating with not only just the patients and athletes, but with their families, with their communities, with the professionals that are involved in their care in really a responsive and responsible manner that really supports that team approach to the promotion and maintenance of the health, prevention and treatment that all athletic trainers, we target every day, and to really improve, again, that quality of care that we're delivering. And then lastly is the team and teamwork. And that kind of, wraps up the interprofessional kind of collaboration. And what we're trying to achieve is just applying the relationship building values and the principles of the team dynamics, and really making that a point to focus on within our settings. To really perform effectively in different team roles. Every professional has a different role in the care of that specific patient. And at the end, we all have the same goal of to deliver, quality care and get that patient back to, pain-free and back to sport.
And I love how during your presentation, you referred to the term empowerment. Can you speak to how those four principles, those four pillars, really lead to the empowerment of each team member?
So the term empowerment, especially in the healthcare setting, work-related empowerment of healthcare professionals is really essential when we talk about interprofessional collaboration for delivering that high-quality patient care. The perception of high work empowerment, has a positive effect on quality of care, outcomes of care, in terms of, the effectiveness, safety, and patient-centeredness. Chris, was presenting with me, and, as an administrator and myself, managing the athletic trainers. As administrators, we're also responsible, for managing employees as they also, contend with new laws, and, healthcare is constantly changing laws, regulations, technology, just economics. Okay, so it's up to us to really empower our teams and also empower the entire organization. I feel like it's a trickle down. If we empower our team, we're also empowering the organization, which at the end, everybody's motivated, driven, and you're seeing good results with that. But it also has some associations with, individual and organizational factors. So depending where we are and what kind of how our structure of our organization is, there could be some, factors that play into, empowerment. But, every health profession really has its own subculture. It has its own knowledge base and philosophy. Just because one orthopedic practice does things one way doesn't mean the other is going to, be the same structure in that. So when you add power structures, some members' voices, we talked about, get prioritized over others. and that's not really good for staff morale. So having that open concept, empowering your employees from the top down, saying, yes, you can, reach out to me anytime with any concerns. And it really, interprofessional collaboration really levels that playing field, like we talked about, where it acknowledges that everyone plays a vital role, not just based on your title or how high up you are in the structure of that organization. In the sense that, community and camaraderie can also boost staff retention and recruitment. So there's really important parts when we talk about empowering our employees, and especially in today's society with dealing with COVID, dealing with all these issues, economic, social. So it's kind of all at once kind of hit us at a managerial level to empower our workers and keep them driven and motivated during these difficult times.
And that bridges really well into what Chris spoke to during his segment. And Chris, you specifically mentioned the paradigm shift which has occurred. We're looking at things here in 2022. Why is that collaborative care so crucial?
Yeah, so collaborative care is so crucial because of the ultimate impact it has on patient outcomes. So, and that's why we're all in this profession in the first place, right? So increased communication between healthcare professionals across the continuum of care has time and again been shown to increase not only patient satisfaction and general engagement, which we know improves outcomes in itself, but it also improves provider satisfaction. So in a time, as Marc mentioned, where we're so focused on the well-being of our healthcare providers, to the point where this very topic was specifically mentioned in the State of the Union this week, it's very important to think of these variables and collaborative care as a whole as we design new models of care. So when I say new models, I'm referring to the entire system's shift towards value-based care, which really focuses on total patient outcomes rather than fees for specific services. So we already see some of these models being tested in musculoskeletal care with total joint arthroplasties, but there's so much more potential to keep this momentum at all levels and keep coming up with new systems that can kind of foster this collaborative care. So our latest goal in this specialty is to kind of build this infrastructure that facilitates communication and collaborative care between all these healthcare professionals, really ultimately in anticipation of these new reimbursement models. And we're very excited to see how athletic training kind of fits into this system.
And I love during your presentation, you mentioned the word consumerism, and whether the athletic trainer is treating someone that they are billing for or not, the reality is they are the consumer of that service. And we have to keep in mind that that experience matters truly through that whole situation. So I'm glad that you alluded to that when you were talking about that paradigm shift as well. What are some specific strategies that athletic trainers can, take action upon to enhance their interprofessional collaboration in their own setting?
Yeah, so Marc mentioned this at the annual meeting as well, but it's certainly worth repeating. Taking the initiative, really, in whatever setting you find yourself in, whether it's a school or an orthopedic office, to really connect with the other providers involved in the care of your patient. And that's incredibly effective. So kind of creating your own communication channels and personalized connections and network with a physician, a physical therapist, or whoever might be involved in the patient's journey through the healthcare system. And that's really what it is. Any encounter for a patient is really a journey of care. That goes a long, long way to increasing the value of everyone's collective care in that system. So the fact that athletic trainers are quite literally on the front line of care is being increasingly recognized, which is fantastic. So we're certainly, we do encourage taking that initiative to forge these relationships.
Well, I can't thank you enough for bringing this topic to the forefront of conversation during ATSNJ 2022. It's an essential thing that we need to discuss. It's not just the clinical skill set that but it's also how you deliver those clinical skills to really serve the people that we serve. And this whole interprofessional collaborative approach is crucial in that whole thing. So thank you so much for taking some time to discuss this and for your key points, and continue to do those great things that you've been doing.
Thank you for having us.
Thanks, Ryan.
You're welcome. Have a great day.
You too, Marc.